Hello, everybody. Thank you for having me here today. It's really lovely to be here. So today I'm going to present the gendered experience of mesothelioma study. Okay, so just to begin with, I'll give you a brief project overview. So our aim was to explore men and women's experiences of mesothelioma and to understand the similarities and differences that occur across the mesothelioma pathway from the perspective of patients. So it was a mixed method study. Stage one was the statistical analysis of national data. Stage two involved qualitative interviews and analysis. And then stage three involved testing the findings out with key stakeholders in focus groups. Okay, so HASAG, which is an asbestos support group from the south of England, very kindly provided us with a data set with cases from 2016, 17 and 18, and we had 1,177 mesothelioma cases. As you'd expect, the majority were from men, so 83% were from men and 18% were from women. So we found a few differences in the HASAG data set. Firstly, in age. So both men and women were mostly in the 71 to 80 age group at diagnosis. But what we found was that there were more young women in the cohort. So 5% of women were under the age of 50 compared to only 0.5% of men. Another interesting difference that we found was that fewer women had a next of kin. And also fewer women had a spouse or a partner. Now, when we were looking at types of mesothelioma, again, as we'd expect, we saw the majority of cases were pleural, but we did have 1% of cases that were peritoneal. And we found that women were more likely to have peritoneal. Okay, so we also explored compensation a little bit and what people felt about that. So proportion who said they were going to call a solicitor and proportion who said who actually called a solicitor. So what this means is that the percentage of both men and women who are going to call a solicitor decreased over the 3 years, which surprised us. And the trend was the same for both men and women. And the number of men dropped by 12% and for women it was 27%. So what that means is the percentage of women who seek legal advice dropped by nearly 20%. Now, so we spoke to our legal colleagues and kind of asked for some explanations of what might be going on there. And I think it's important to highlight that this is a relatively small data set. So these findings need to be tested out in a larger number of people. But yeah, we thought it was interesting. Okay, when we were looking at occupational risk, our findings were that the high-risk occupation for men was construction, carpentry, joiner, plumbers, electricians, all the things that I would say you commonly associate with asbestos exposure. But what we saw in the women was that the high-risk occupations were in administration, teaching, healthcare services. So I think it's important to highlight that we might need to look at risk, occupational risk in different ways for men and women. Okay, and then we also looked at the industrial injuries benefit. We missed out a word there. So we found that 11.6% of women did not receive the IIDB award compared to only 3% of men. And when we measured time from diagnosis to IIDB award, we found that the median time for men was shorter than for women. So women were taking longer to be awarded their award, their benefit. So now in stage two, we interviewed 11 women and 13 men who were kind enough to participate, and we're just really grateful because Meso UK asbestos support groups were absolutely fantastic in helping us recruit to this study. So we had a range of ages. Well, we tried to get as much diversity as possible. So our age range was between 31 to 79 years of age. We had a range of living circumstances. We did manage to find 2 Scottish participants. The length of time living with mesothelioma was between 5 months to over 5 years, and we had a range of occupations. So the first key finding I'd like to talk about is that obviously a diagnosis of mesothelioma was absolutely devastating, and that always comes across in any interview that we do. But what was interesting was that men and women were both practical at diagnosis, but the way in which they enacted that practicality differed. So as you can see, Amy here, sorry, I should highlight we're using all pseudonyms. So Amy here says, you know, the first thing she did was to come home, chuck everything away, because her idea was that men don't wash net curtains. And we did see this in the women's interviews, that the domestic sphere and making sure that the family would be okay in terms of the running of the household, domestic chores, and emotional management also was taken care of. And what we saw in the men's interviews was it tended to be about financial management and the paperwork. So what Ivan did was to put all his affairs in order so that he didn't have to leave his wife with a heap of stuff to do, as he said. So control and treatment was another interesting one, particularly around treatment and trials decisions. So again, we've got Ivan there saying, I'll be telling them to stick the chemo where the sun doesn't shine. So the way in which the men spoke about their decisions was a lot more assertive and decisive, even if later on, as was the case in Ivan, they said, actually, I do want the chemo. And women tended to go for the, I'm not really sure, I'm not very good at making decisions. And it was just a very different way of expressing themselves, which, you know, as healthcare professionals, we need to be aware of. So when it came to impact on family, I've got two quotes from women here, because what really came across was that emotional burden, the emotional management. There Kath is saying she wasn't sure about going on a trial because she had caring commitments for her husband. And then Grace there was, you know, I'm not sure when I should ask my partner to come and visit me because I don't want to have a bad impact on his mental health, on his anxiety. And so that emotional aspect was really there in the women's accounts, whereas with the men, it was all about the financial well-being of the family. Risk perception. So although we were studying gender, there was also something about the occupations people worked in. So there you've got Fred at diagnosis. His feeling was a sense of inevitability. You know, he had friends who had asbestos related diseases or who had died of asbestos related diseases. So at diagnosis, you know, devastating, yes, but not really a surprise. Whereas for women, especially those who hadn't worked anywhere near asbestos or had partners or husbands or fathers who had worked in asbestos industries, you know, Fiona thought, what a stupid question to be asked, because asbestos related diseases weren't even on their radar. So seeking compensation, this was another interesting one, because you've got Irene there who wasn't 100% convinced. Women seemed a bit reticent, a bit reluctant to pursue compensation, or at least the women we interviewed. So that aligned with what we found in the numbers data and the quantitative data. And then Ivan there is saying, I deserve that and I should have that. So there was definitely a sense of entitlement for the men. But that entitlement was born out of a desire to look after their family and provide for their families. Okay, so stage 3 kind of got cut short because of COVID, but we did manage to speak to a group of Meso UK nurses just to test out our findings and get their thoughts on that. We have done some dissemination. This also counts, so I'm really happy to be here. So important points from the data is that the importance of a sense of control at diagnosis may differ between men and women, and this difference may have implications for the delivery of healthcare. And women and men may have different priorities during their mesothelioma journeys. Women may lack awareness of the risk of exposure and asbestos-related diseases. The nature of exposure to asbestos may be quite different. Therefore, we need to consider occupational risk different for men and women. And women are less likely to seek compensation according to our data set. So this could be due to lower awareness amongst women and a higher sense of entitlement amongst men. So in terms of the next step, we've got a report due to launch. We've got a couple of publications that are, that we're preparing. And I think what we're doing is trying to kind of bring together quite a few studies that we're working on and develop that. So we've recently been awarded the Mesothelioma UK Research Centre. So that's due to launch on the 23rd of November, and it's going to be led by Professor Angela Todd and Dr. Claire Gardner. So our vision is to conduct a portfolio of robust and rigorous research with a reputation for excellence nationally and internationally. I've run out of time, I think, but I've just got a quick list of the projects that we're working on at the moment. So please do contact us for any research ideas. And we're running a research prioritization exercise. We really want kind of the lung cancer, the mesothelioma community to come together. That includes healthcare professionals, legal professionals, patients, carers, anybody who might be involved, to say what do you think is important to the patient and carer experience, how can we improve it, and then we're going to have a mailing list, so please do contact us if you want to be added to that mailing list. So yeah, lastly, just to say thank you for listening, and thank you to, of course, everybody who participated, to Mesothelioma UK and the others who funded us. So thank you.